Hello, Professor Beryl here, and gonna do a head-to-toe assessment with my patient, Miss Teddy, right here. Um, Little history on Miss Teddy. She is a nursing home pay admit, presenting with stomach distension as well as pain on all four quadrants of the abdomen, and she also said that she's had light vomiting. She's had no appetite for the past 3 days. She also has not had any stool for the past 3 days. Little um, past medical history is the fact that she has osteoporosis. She also has UTI as well as chronic pain. She said that she's also allergic to morphine, Demerol, and Colace. And yeah, so she's here today for a head-to-toe assessment, which we will go ahead and begin um, um, with the head-to-toe assessment. So prior to beginning the head-to-toe assessment, I will go ahead and introduce myself to the patient. My name is Beryl, and I'm your nurse for today. Prior to beginning the process, I will wash my hands and ensure privacy. Okay. Once that's done, I will come again and I will just ID the patient. Could you just confirm your name and date of birth? So you are 95 years old, correct? All right, and Ms. Teddy, and do you, also I should let you know that we are here to perform a head-to-toe assessment. Is that okay with you? That's okay with the patient, so we'll go ahead and proceed. And if I may ask, just to test your orientation, you did say that you know your name, you know your your date of birth, which by stating your age. Do you know what time it is, what month, what year it is? You are familiar with the year 2020, April 2020? Correct. That's good. Are you familiar with where you are? You're familiar with the place. Okay, we're at the hospital. Good. Do you know why you're here? You're not quite sure why you're here? Okay, that's fine. So the patient is alert and oriented times 3, which is amazing. So we'll go ahead and perform the vital signs. So the blood pressure is along the normal range, 120/80. The temperature is 98.6. Respirations are normal, 16. The pulse ox is 100%, which is all normal. And yeah, so that's amazing. So we'll go ahead and proceed with the assessment. So beginning with the head, I can inspect the patient's head. Upon inspection, it's symmetrical. There's no trauma, no signs of any trauma. Hair is evenly distributed. Can go ahead and inspect the face as well. The face seems symmetrical also. The color seems, in compliance with the patient's ethnicity. I don't see any bumps, any abnormalities. What else? We can go ahead and inspect cranial nerve 7. Patient, could you smile? Could you puff out your cheeks? Could you frown? So the patient is able to do all these things. Could you show your teeth? Okay, and also I should note that the patient has dentures. So Anyway, with all that said, cranial nerve 7 is intact. So once we've done that, I can put on my gloves and palpate the scalp. Just check the hair, for any lesions, bumps, any abnormalities like lice or any infections or anything, and there are none. The hair is fine, which is what we want, So that's good. All right, so we can go ahead and inspect the eyes. Sclera is nice and clear and white. Eyes seem to be symmetrical. The movement is symmetrical. So the patient doesn't have any glasses, no visual problems. They didn't state that they had any headache. Conjunctiva looks normal, looks nice and moist and pink. We can also test the pupils. So if I had my pen light, I would shine light on the pupils to see how it reacts. So the pupils are reactive. They're round. The parlor, the pupils are equal in size, which is a 3. They're also round and reactive to light, and they accommodate well, which is the expected results or the expected outcome of the pupils. So we can proceed on to so we've done the head, we've done the eyes, we proceed to the ears. So I inspect the ears for any abnormalities. There are none. I can go ahead and palpate. I can lift the ear up and out and then shine my pen light inside. I don't see any drainage. It seems clean. There's no obscuring. I can see the inside of the ear. This is expected result of this inspection. After the ears, we can go ahead and assess the nose. The nose seems symmetrical. I don't see any obstruction on the nose. The septum is intact. No abnormalities to report. And then we can move on to the throat. You can open your mouth, please. So I would shine my pen light inside the mouth to view the throat. The oral mucosa seems normal, pink and moist, which is what's expected. And then we can proceed to the neck area. So upon inspection, the neck seems even. I don't see any palpate. The pharynx is normal. There are no tonsils, no swelling. And the neck seems normal as well. No swelling, no redness. Can palpate the lymph nodes. They're non-tender, which is an expected result. I can go ahead at this point and check the skin turgor. Skin turgor is good. At this point, I can also check for jugular vein distension. There's the jugular vein is not distended. I can also go ahead and palpate the carotid pulses individually. So one side first, 2+, normal pulse. The other side also 2+, normal pulse. This is all in line with what's expected. So after the neck, we proceed to the chest. Excuse me. And with the chest, we have the heart and the lungs. So first of all, we will auscultate the heart for any heart sounds. So and to auscultate the heart, I would first auscultate the aortic valve on the right, and then I would auscultate the pulmonic valve on the left, and then I would auscultate Erb's point beneath that, and then I would auscultate the tricuspid valve, and then I would auscultate the mitral valve. And the mitral valve is where you auscultate for the apical pulse, and I will listen for a minute. And we're gonna say the patient, the pulse is within the normal range of 60 to 100. All right, so after the heart, then we would go ahead and auscultate the lungs. So anteriorly, we would auscultate the lungs. So I would put on my stethoscope and start with the apex. So I'll start with the right upper lung, and then I'll go to the left upper, and I'll go to the right middle lung, then the left upper, because the left side only has two sections. Then I'll go to the right lower and the left lower, and then posteriorly I would also do the same, the right upper, and then the left upper, and then the right lower, and then the left lower. And then that's as far as the chest goes. Then we would proceed to the peripherals and the upper extremities. So we would just inspect the shoulders, the elbows, the hands, and just inspecting for any lesions, any temperature, any tenderness, any swelling. There's none of this is found with our patient. So we would go ahead and palpate. I can start with the radial pulses bilaterally. I would listen for a minute, and they're normal within the 60 to 100 range. Assess the shoulders, assess the elbows, move them, check for strength. I would push against resistance, have the patient push back, to check for strength. Okay, then I will go ahead and assess the hands, the fingers, inspect the hands and the fingernails for color to make sure that there's no discoloration. I will check the capillary refill on all the fingernails. If it's less than 3, that's what we expect. If it's more than 3, then that signifies like some type of heart or circulation issue. All right. I'll also check the skin turgor. Skin turgor is good because it bounced back. That's what we expect. And then we would go and proceed to the lower extremities. Lower extremities, that is the legs, the hips, the knees. I would assess and inspect the hips, the knees, the feet, any abnormalities, any swelling, any bumps, any bruises, any injuries. There are none. And then I would go to the toes and check the capillary refill on the toenails. Again, normal refill. They refilled within less than 2 seconds. That's what we expect. I would check the dorsal pet dorsal pulse, the one behind the knee. Now I would listen for a minute, ensure that it's according to normal range. I would no, that's the popliteal pulse, and then the dorsal pedis, the dorsal pedis pulse. That one is on the foot. All right, and then I would check for strength. So I would push the leg against resistance. Make sure that there's no that there's resistance to check for strength. All right. Now we would also go ahead and check for the spine, the back and the spine. I'll check for the curvature of the spine. Make sure it's it's not curved, or there's no bumps, no swelling, no abnormalities on the spine. I would also check for the skin color. Make sure it's normal.